Dr. Praveen Chandra heads the intervention cardiology, is the chairman for intervention cardiology at Medanta, Medicity, Gurgaon, and he's one of the globally renowned intervention cardiologists, uh, both in on cardiology side and also on the endovascular and peripheral side. He's a fellow of Endovascular Intervention Society of India and Asia Pacific Society of Intervention Cardiology. And last but not the least, Government of India awarded him the civilian honor of Padma Shri in 2016. I had the privilege of working with Dr. Chandra 4 years, and I'm very happy to see him hale and hearty back. Dr. Chandra, to give you a brief on Polymedicure. So, Polymedicure, we are an Indian medical technology organization, and we operate in about 110 countries, including India, and we are the biggest exporter of medical technology from India. We operate primarily in the field therapy segments of infusion therapy, renal, transfusion, and diagnostic. And possibly in the near future, we may be into cardiology on the excess side, and then we may come over to you as and when appropriate. Uh, I'm very happy to have you on board to spending time with our team and also external audience. We try to socialize it. So if you see, there is a mix of our internal team and people who have just walked in and may want to hear your views on the good practices, how to have a healthy heart, and on a lighter note, how to avoid a visit to an intervention cardiologist. So, and that's on a lighter note. So please help us out, and happy to hear you, and would be very nice of hearing your views on that. Over to you, sir. Thank you very much.
Thank you. So it is a pleasure to be amongst you people, and I'm sure people are a little bit interested in keeping their heart healthy, and why it should be so, I'll tell you in a little while. But let me ask you one question. Is it okay to speak in English, or you want Hindi or some, Huh?
Go ahead in English, sir. There's no problem.
Acha, no problem.
Yeah.
Everybody can understand in this
Absolutely.
Good,
Absolutely.
good. Okay, great. So, or maybe I'll use some Hindi words so that if there are somebody who wants to love and like to hear in Hindi, why not? Okay. So basically, heart disease, as you all may or may not be knowing, is the most important disease for the body. Why? Because the biggest killer of mankind. So I'm starting on a very grim note. So the biggest killer of mankind is heart diseases. Even in India and worldwide, about 25% of deaths actually happen because of heart problems. So that is why treating a heart disease early is what we are aiming at. And even earlier, preventing heart disease is even the biggest challenge as of now for us. Why I'm saying so? Well, many times people say, I get my checkup done every year. I do this, I do all kind of things, and still I got a heart attack, or still I got a heart problem. Why? And you were doing a checkup and the doctor said everything seems to be okay and was fine. So the point is that now we have recognized that there are many factors which play a role in the development of heart problems in any individual. And anybody can have a heart problem, let me tell you, because everybody has a heart. And there is only one heart in the body, that is another problem. It is not like kidney or the 2 ears or 2 eyes, that if one eye goes, the second will work. But in heart, it is only one. And the other important thing is that the heart actually controls everything else, which happens otherwise also, because heart has a control on the mind, and heart has a, whosoever controls your heart will control you, Though you know all those things. So the heart is the control center, or I must say the engine of the body. So like a car, you can have 4 tires, everything is there, but if there is no engine, nothing works. If the engine doesn't work properly, even if the clutch is very good, it doesn't work. So the heart has to be healthy and should be working all the time for your body to function normally. So we have to take care of your heart. That is why I am stressing again and again as to how you can keep your heart healthy and be away from people like me or the doctors. Okay? That is what Manish wants, that we doctors should just keep talking to you and keep you healthy. Right. So, and let me tell you, if you follow this, there is a 80% chance that you are not going to see a doctor. Do you believe this? If you do a test, there is a 80% chance that you will come to the doctor again. But if you listen to us and follow us, there is a 80% chance you will not need a medicine or a heart intervention or a surgery or something like that. So the challenge today is that how to keep us healthy. Now, what are the ways to do it? What are the simple ways? The most simple way is to know a few risk factors, whether you are falling into the high risk group or you are falling into a low risk group. So anybody who has diabetes, who has high blood pressure, or who is a smoker, or has high cholesterol, these are the people who are at high risk. So how do you know that you have high blood pressure? You have to get your blood pressure checked on a regular basis. How do you know that you have sugar? You have to get it checked once in a while, that whether you have sugar or not. Then how do you know that you are having high cholesterol? That you have to check it by a blood test and then see how much cholesterol is there. So these are the 3 tests, very simple, very inexpensive, to find out whether you are at risk or not. Now that is the test part of it. But many things are there which can be done without testing. One is, are you smoking or not? You don't need a test for that. Just ask yourself that whether you are smoking or not. And I cannot know whether you are a smoker or not by looking at your face or doing a test. So you have to tell me that whether you are a smoker or not, and you have to tell yourself. And smoking is bad. Let me tell you, it's not like this, that I smoke 3 cigarettes only, I'm fine, I don't smoke 10 cigarettes. Sometimes people say I only smoke filter cigarettes. Somebody says I only smoke light cigarettes. Somebody says that, I smoke half a cigarette and then throw it. All that is not permitted. Okay? So smoking is something which you can give away, no money spent. You save money. Second is exercise or activities. Many of us do not do the physical exercise or activities and try to avoid that, but we should try and do regular physical activity. Why? And that's not that kind of activity ki park mein jaake toil ke aa gaye. That is not a good level of activity, because us Indians, we are thin obese. समझ गए ना? Thin obese मतलब our body is patla, but our belly is more. So this is a very typical obesity of India, and this obesity only goes away if you do vigorous physical activity. It doesn't go away. So many times you hear that somebody is saying that I have been walking, 45 minutes every day, and still my weight is not going down, my belly is not going down. Why? Because they are not doing vigorous physical activity. Okay? So this is very, very important to know that activity has to be vigorous to really make an impact on bringing down your belly. And that is very, very important. Now, what is the next? Next risk factor, again, which can be controlled without medicines, is mental stress. And this all has been studied. This is not I'm talking like a Babaji. It has all been studied in a big study which was done, which is known as the Inter-Heart study, which was done internationally, and lot of patients were included from India. And it showed that anxiety and stress are big factors which precipitate heart problems. And that is why you see that sometimes when people are in too much stress, they suddenly go to the heart doctor and find out that there is a heart problem. So people think that it happened now. It's not. It has been happening. It gets precipitated. So to keep the heart healthy, you have to keep your mind healthy. And you have to make efforts to do that. उसके लिए क्या कर सकते हैं? You can do yoga. You can do relaxing things. And that is why many companies now have this policy that to maintain good mental health of these, their employees, they want them to play a little bit in the, sometimes during the working hours. Sometimes they have to do some recreational activities. Sometimes they do social activities. What are they? These are anti-stress activities. When you are meeting somebody socially, then you are reducing the stress. When you are meeting somebody out of the office and conversing, then you are reducing the stress. So stress reduction is very important. Meet your friends, meet your family, talk to them, and that is a big relaxation for most of us. However, other activities like watching a movie, watching a serial, or reading a book, listening to music, all these are relaxing activities. It may be different for different individuals. Some people feel happy by listening to music. Some people are happy, reading a book, and all kind of stuff. So relaxation, you have to find your own relaxation technique. Again, no money is spent. No, not going to the doctor. You do it yourself. So that is very important. Then next, still there is something which you can do where no money is spent and you can reduce your chance of a heart attack. What is that? Eating more vegetables and fruits. Because typically our intake of vegetables and fruits have gone down because on a day-to-day basis. So that is what has to be done. We have to go back to our natural ways of eating. In India, I must say that the Indian food practices were very good earlier because people were eating dal, roti, sabzi, and seasonal fruit and salad, which is a seasonal thing, less of oil, less of fried things. And that was a usual Indian frugal diet, I must say. In every home, about 50 years back, 60 years back, 70 years back, that used to happen. And people used to take sweets, people used to take fried stuff only if there was a festival. And it was a saying that if you are eating sweets, that means there is some celebration. If you are eating, fried stuff, that means there is some celebration in the house or in the community. But today, since the oil has become the cheapest component of the food, earlier oil was the most expensive component of the food. If you look back 50 years back, things have changed. Vegetables were cheapest. Now, vegetables are most expensive. They are 200 rupees a kilo and sometimes even 500 rupees a kilo, and oil is cheapest. So, lot of oil usage has started happening in houses and it has become available. Butter is much more commonly available. It was not available earlier. Very few families. Then non-vegetarian food was also not all that common. People used to take it in a very balanced way because it was expensive and it was also a luxury to eat these things. Eating eggs was a luxury for most households in India, I must say. But now eggs have become cheaper than vegetables. So people will much rather eat eggs. Not I'm saying that eggs are bad. What I'm trying to say is that the eating patterns have changed. So go back to our own basic eating patterns. That's how our body is made. Our Indian bodies are made like that, and during thousands of years. And this is known as Thrifty gene hypothesis. There is a science behind this. What it says is that us individuals, like Indians and Asians, are made to be frugal in life because it wasn't available in abundance at that time. So our genes are adapted to that. And if you feed these bodies so much that the genes cannot actually assimilate it or accommodate it, it will lead to disease. And that is why this is known as Thrifty gene hypothesis. So we have to understand this, that genetically we are not made to eat that much and that kind of stuff. So that is the risk factor which we can control ourselves by just knowing it, and just be aware of these things and you will be fine. So these are the 7 or 8 risk factors which I wanted to let you know. If you have these risk factors, then you have to be careful. You have to do if somebody has a blood sugar, then what happens? He has to control his blood sugar on a regular basis. Keep it checked. People don't want to check it because if they find it high, then they have to talk to the doctor, they have to increase the medicines, and they don't want to do it. So keep checking your blood sugar on a regular basis. Second is blood pressure. If somebody has a blood pressure, the most common answer which I get from my patients who come to see me, that is it necessary to start the medicine? Should I not start the medicine? Because if I start taking it, I have to take it for the whole life. So that is not the right approach. If you have a blood pressure, you better take the medicine or do lifestyle changes so that the blood pressure comes down. Because high blood pressure is a silent killer. It actually consumes your body. आपकी body खर्च होने लगती है ज़्यादा because the body has to work more, and the heart becomes sicker, the brain becomes weaker, and the kidney becomes weaker. So blood pressure control is the simplest thing which can control all these 3 serious problems. So please check your BP and get it under control. And if the doctor is advising to take medicines, please take it. And the last thing I'm going to tell you about is the cholesterol thing, that the cholesterol has to be checked. And if the cholesterol is on the higher side or it's high, you have to take lifestyle modifications. If it doesn't work, do not leave it like that. Must take medicines as prescribed by your doctor. And it has been seen that if you take medicines, if you have high cholesterol, you will reduce the chance of heart attack by 50%. So prevention can be done if it is done properly. So please take care of yourselves. And if there are any questions, I'll be very happy to answer.
Good afternoon, doctor. My name is Hemant. It was really nice to know all these points. My only one question is, like, when you mentioned about the oil part of it, and yes, that is a fact that we have started using more of oil. So which is that oil which you will recommend? Because there are a lot of myths available that mustard oil is good or the olive oil is good and things like that. So if you can suggest something on oil.
Yes, certainly. So the myths are too many now, and it has been kind of changing over a period of time. So earlier people started saying that deshi ghee is kharab, and they said that refined oils are good, which is probably not true entirely. So the oils which are compressed from a seed, like the mustard oil is compressed from a seed. It is a natural juice of the seed. Like olive oil is a natural juice of the seed. It is not chemically modified. So these oils are good. And also they contain high level of polyunsaturated fats, which is good for the body in obviously a ratio. So these oils which have good ratios are better. So mustard oil is good, pure mustard oil. Then the second is the olive oil is good, and especially the extra virgin olive oil is good. And then of course other oils are also okay to make for cooking purposes. For example, One can use this curdy oil, one can use, which is safola in a way. But however, since it is refined, that's why we have started saying that refinement is not a very good process, because it heats up the oil a lot and then also cools them. So some kind of changes can happen. And that is why we are not, promoting this kind of, therapy that you take refined oils too much. Deshi ghee is also okay to be taken in a small quantity. So if somebody takes 1 or 1.5 teaspoons in a day, it's okay. It's not a problem. You can take this. You can take butter. Everything is okay, as long as your weight is not going up. Okay. If somebody's weight is like way beyond, like 100 kilo plus, he cannot take oil, because oil contains a lot of energy. So if he takes oil plus all the food to satisfy his appetite, he can never control his weight. So for weight control. Otherwise, if somebody's weight is okay, he can take oil, no problem. Because heart disease is not directly connected with oil. Earlier, we used to think this way, but now we understand that it is not true. Cholesterol is made by the body. Even if you take sugar, or if you take carbohydrates, it can convert into cholesterol inside the body by the liver. So that is why you can take all kinds of oil, take in moderation. There is like, if you take too much oil, then weight will start going up, and then you cannot eat that much. So you have to balance the calories, and in balancing the calories, you have to reduce the oil intake.
Thanks, sir.
Thank you. Yeah, hey, Arijit, please go ahead quickly. Yeah.
Yeah, I have a couple of, maybe I'll request Dr. Chandra to express his views on. One is that on the salt intake, so because it will have some repercussions on the cardiac health. And number two, when you talk about exercise, what type of exercise will be more suitable for people like us who have to manage a schedule?
Yeah. So walking and running are very good exercises, which is very balanced exercise, and one can just do without any gym or any kind of activity. And also doing yoga like, various kind of pranayama and yoga is very good. You can do that, and that is quite helpful. But weightlifting and doing muscle building exercise is something different. And of course, I'm not saying that you don't build the muscles. Muscles are very important for the little part of life. So muscle building should happen to a reasonable extent, because muscles actually protect you. They are kind of an immune system. They control the immune system. So you must have good muscular proportions in the body, so that you are protected from immune attacks from outside. And you were talking about asking about
the salt intake, because we indulge in a lot of fried foods and all today.
Yeah, so the salt intake is basically something which leads to high blood pressure, and excess intake of these processed foods, excess intake of pickles, all these increase the salt intake, and using the added salt on the table. These are the three main things. If you control that, then the salt intake generally is okay. For usual person who is not a heart patient, generally it is not such a serious problem. But somebody who has a heart weak and has a heart problem, in those patients, they should try to control salt intake below 5 grams per day. And you can imagine, how do you know this? There are pouches which are made, which are sold in the market, or you get whenever you go in a plane. So these are 1 gram pouches. So which means you can use 5 pouches a day. That's all.
Thank you, sir. Thank you.
Okay.
Thank you, Dr. Chandra. Can I ask you something, which is this CHF is something, heart failure is something which not many people in the masses know about. We know about blood pressure. We definitely know about heart attack, everything. But heart failure is something all of us are almost ignorant about. Will you be okay telling us, for the masses as a layman, What could be the symptoms? Because normally heart failure is something which just walks in and people are not even understanding how does that happen.
Yeah. So heart failure or congestive heart failure and or congestion in the heart, these are, uh, same things. Basically, it happens when the heart's pumping power, heart is a pumping station. So when the heart's pumping power goes down, that is when the heart is failing. And when does it happen? It happens in those patients who have had a heart attack or a viral infection of the heart. That leads to weakness of the heart. So how do you know that somebody has a heart failure or is going to have this kind of symptom? In those people who are getting breathless or getting swelling on the feet, which is suddenly come up and without any rhyme and reason, in these patients one should start suspecting and they should go to the doctor to find out whether he has weakness of the heart muscles or not. And in case they find that yes, there is a possibility, they will do an echo test to confirm it. So echo test is the main test, and the main symptom is breathlessness on exertion, on climbing stairs, on any activity to start with. When you do an unusual activity, however, when it becomes too much, it can even happen when you are going to the bathroom, you are going to the toilet, you are going to the kitchen, it can happen.
Thank you, Dr. Chandra. So today you helped us understand that heart attack is not good luck or bad luck. We have a role to play in that. And if we can do something on,
Yes.
if we can take care of few of the things, we can avoid walking into an intervention cardiologist. Definitely not to seek your intervention, but as a friend, anytime. And my request to all of you, I can vouch for Dr. Chandra. God forbid, nobody else should need an intervention cardiologist. But if we need, I think you're talking to the best. Dr. Chandra is sitting among there. So please feel free to reach him if you need his help. Thank you very much, sir. Thanks for your time.
Thank
I
you.
look forward to
Bye-bye.
come and say my regards to you. Long time. Whenever things are back to normal. Thank you for sparing your patient
Sure.
time. And please take care of yourself, sir.
Bye.
Thank you. Thank you very much.
Thank you.
Bye-bye,
Bye.
sir.